Dr. B again with Functional Minute. Today I want to talk to you about heavy metal toxicity. This is a common problem we see in our office each week, especially in patients who have been to multiple doctors, have had multiple tests done, and still can't figure out why they're feeling sick. Heavy metal toxicity is something that's very much under-tested here in the United States. Now, what is heavy metal toxicity? It's not that you listen to Whitesnake or Def Leppard too much. It really encompasses a history of exposure to certain chemicals in our environment. I've talked about toxicity quite a few times in many of my talks, but heavy metal toxicity is something that definitely needs to be tested more. When I say heavy metal toxicity, the two heavy metals that we see the most are lead and mercury toxicity. Approximately 2.5 billion tons of chemicals are poured into the environment every year. This is typically found in our soil, in our water, and primarily our food. Multiple studies have shown that about 40% of Americans are at risk for certain health diseases as a result of heavy metal toxicity that's never tested. Certain studies have shown an average babies in their cord blood that was tested, there are an average of 287 chemicals in cord blood. These chemicals are actually passed down from the mother and father. When we look at heavy metals, this lead and mercury typically can stay in your tissues for about 30 years. So it's something that can cause problems even years down the road after exposure. Typical diseases that are associated with heavy metal toxicity are coronary artery disease, high blood pressure, Parkinson's disease, Alzheimer's, autism, ADHD, autoimmune diseases, especially your gastrointestinal problems, including ulcerative colitis and Crohn's disease, chronic fatigue syndrome, cancer, and hormone diseases. History is extremely important when you're looking at heavy metal toxicity. Our typical patient that we'll see will be someone who comes in who's had several years of fatigue, joint pain, gastrointestinal problems, and everything has come up negative. And so it's really good to delve into history when you're looking at a possibility of heavy metal toxicity. So what to do? What do we do when we're thinking about heavy metal toxicity? Well, first of all, it's good to get tested. Now, there's a lot of blood tests that are out these days that can test for lead and mercury and some of these toxins in your body. The blood tests are typically only good for about 30 days. They're good to test for a brand new exposure to these toxins and these heavy metals. The one that we usually recommend in our office is called a DMSA urine provoked test. Typically what you do is you'll take a chelator agent called DMSA. DMSA pulls heavy metals out of your soft tissues into your body, and so you pee them out. And so you can test for your overall body load of heavy metals with this. And so you take this DMSA, and then you collect your urine for about 8 hours, and then you send it into the lab. And it's a really good test to really see truly what your lead and mercury levels are. When I first started testing with this approach, I was typically looking for mercury. And every one of our patients that we've seen so far with this test have tested high for lead. So we see some mercury elevation, but lead has been the big bad one that we've seen. So this is definitely something to think about. Also, it's good to check your water at your house. There are certain tests through certain companies that can test your water to see if there's elevated aluminum, lead, and some of these other chemicals in there. So that's a good way to do that. Another thing to do is make sure your bowels are functioning okay. I keep saying this in every one of my videos, it seems like, but you got to be pooping at least once or twice a day. It's pretty much that simple. And that helps you eliminate these toxins that are typically peed out or pooped out. Also, it's good to get a water filter at home. You can get it's called a reverse osmosis water filter or a carbon-based water filter. You can put on your shower head, and you can put it on your tap water. So it's a great way to filter out a lot of these heavy metals and other stuff as well. And then one of the treatments for heavy metal toxicity is chelation. And you can do it through an oral route. or you can do it IV. I typically recommend the oral route. It's easier on the body, and typically you have to prep your body beforehand though. So anyway, if you have any comments, please feel free to comment at the bottom of our page, and we will talk to you soon. Thanks.